I would like to welcome a representative from Vaccine Choice Canada. Again, ask for you to state your name and position for the record, and remind you to please be cognizant of time. I can warn you if there's a specific time frame that you're looking for that you'd like me to interject so that we can allow for questions.
Great. Good morning. My name is Ted Kuntz. I'm a parent and a grandparent, and I've come from British Columbia to spend these 3 days with you. Madam Chair, members of the Standing Committee on Law Amendments, ladies and gentlemen, and all those that I know that are listening on your live stream today. Thank you for permitting someone from away to participate in this opportunity to more fully explore the matter of vaccine mandates and the implication of Bill 39. Before I begin, I want to express my genuine appreciation and gratitude to this government for your warm welcome and for honoring and respecting our voices and our experiences. Your commitment over these 3 days and beyond to invite a constructive and thorough consideration of this complex issue honors democratic and scientific principles and provides a courageous example of how governments can engage citizens in decisions in a respectful and considerate way. My understanding of New Brunswick history and culture is that you have a long and steadfast tradition of care, of pausing, of not rushing into decisions, without full, open, and rich consideration of the impact of one's decisions. This matter before you is not a simple matter. It is complex and nuanced and has the potential consequences that are far-reaching. What is decided and how it is decided has the potential to serve as an example for the rest of Canada. I'm here today for 2 reasons. I'm here because I want the loss of my son to vaccine injury to be just as important as the loss of a child to an infectious illness. And I'm here to ask you to maintain trust in democratic principles and confidence in a citizen's capacity to make appropriate healthcare decisions. You can do this by affirming the right of New Brunswick citizens to free and informed consent. Before I get into the details of my presentations, I would like to tell you a little bit about who I am. Like many in this room, I am a parent. I care deeply about the health and well-being of my children and grandchildren. We all do. We are on the same side on this issue. We all have the same goal: healthy and successful children. And like many of you, I believed, without question, the information I was provided by the medical industry that vaccines are safe and effective. My understanding of the safety of vaccines was altered dramatically when my son Joshua suffered a severe neurological injury from his infant vaccines. The vaccine injury resulted in Joshua living with an uncontrolled seizure disorder and requiring 24-hour care for his entire life. As a parent, I've paid the ultimate price for my failure to responsibly research the vaccination decision. My son passed away in February of 2017. I am here to honor my son and to ensure that his life and death are not in vain. I have no vested interest in what you decide. I am here to help you make the best decision possible for the citizens of New Brunswick. I am also here in my capacity as the Vice President of Vaccine Choice Canada. Vaccine Choice Canada is a federally registered, not-for-profit educational society supported solely by donations from its members. Vaccine Choice Canada was founded by families whose loved ones suffered severe vaccine reactions that resulted in brain and immune system injuries, chronic debilitating diseases, and death. And I just want to add is the use of the term anti-vax is so often used to describe our organization is dishonest and deceptive, and it's disrespectful to describe parents who vaccinated their children and then were injured by the vaccine as being anti-vax. Vaccine Choice Canada works to protect the right of all Canadians to make fully informed and voluntary decisions for themselves and their children. Our mission is to empower individuals to make informed healthcare choices and to defend the medical ethic of informed consent. When my son began to seize following the DPT and oral polio vaccines, I did what I should have done prior to the shot. I began to educate myself about vaccines. What I learned alarmed me and compels me to share what I learned with others. There are those that would claim that I'm sharing misinformation. I respectfully suggest that I'm sharing missed information. I've spent many thousands of hours over the last 30 years investigating vaccine safety science. It's impossible to share what I've learned in the time allotted, and so I would like to focus my comments to the specific issue of vaccine safety. What I've come to appreciate is that a product can be effective and not safe. Our history is replete with examples of this. DDT was effective and not safe. Thalidomide was effective and not safe. Asbestos was effective and not safe. Glyphosate was effective and not safe. OxyContin was effective and not safe. Vioxx was effective and not safe. I could go on. There is evidence that vaccines can be effective in reducing the incidence and symptoms of infections, like measles and mumps. And thus I recognize the desire of government and public health to want to increase the use of vaccine products. There is also evidence that vaccines can cause harm, as it did to my son and to many other families. My concern is that governments and the medical industry have a tendency to oversimplify what is really a very complex matter. This oversimplification and allegiance to an ideology puts us all at risk. While the DPT vaccine that injured my son has since been removed from the North American market because of the amount of neurological injuries that the product caused, it is unfortunately still being used in third world countries because it is less expensive to produce than the acellular pertussis vaccine used in North America. And children continue to be harmed by this vaccine to this day. A 2018 vaccinated versus unvaccinated study of African children conducted by Dr. Peter Abbey revealed that children who received the DPT vaccine had a 10 times higher mortality rate in the first 6 months of life than those infants who were unvaccinated with DPT. So let's acknowledge what this means. It means that children receiving the DPT vaccine are 10 times more likely to die than children who were not injected with the DPT vaccine. In March of this year, Dr. Abbey issued a scathing rebuke to the world's public health agencies for continuing to allow pharmaceutical companies to sell vaccines without proper safety testing. The DPT vaccine is not the only vaccine product to be removed from the market because of concerns of safety and effectiveness. All of the vaccines that were approved for use when I was a child are no longer in use in Canada. The vaccine industry has withdrawn more than 32 vaccine products because of ineffectiveness or harm caused by these vaccines. Yet each of these vaccines was once promoted as safe and effective. So I wish to bring to your attention 5 issues pertaining to vaccine safety. 1, vaccine products do not undergo the same level of safety testing as all other medical products. Most people, including government and public health officials, are not aware that vaccines are not tested for safety to the same standards required of other medical products. Vaccines have been classified as biologics and are exempted from the strict and extensive safety testing required for all other drugs. The result is that no childhood vaccine product licensed for use in Canada has been tested for safety using the standards required of other medical products. In other words, vaccines are not subjected to long-term, double-blind, placebo-controlled studies that are conducted on all other drugs prior to licensing. Instead, vaccines are released to the public with substandard safety testing. The medical industry uses the monitoring of adverse events following vaccination as the primary method to evaluate safety. This means that our children are injected with products whose safety is determined by the amount of injury or death reported after vaccination. This method to evaluate safety is grossly inadequate given that medical professionals are neither trained to recognize or diagnose vaccine injury, nor are there legal consequences for failing to report vaccine injury. And parents who report adverse events following vaccination are routinely told that adverse events are either normal or merely a coincidence and could not have been caused by the vaccine. This is what I was told by my doctor. However, a study conducted, and this was reported yesterday at Harvard Pilgrim Hospitals for Health and Human Services in the United States, concluded that fewer than 1% of vaccine adverse events are reported. This means that 99% of vaccine adverse reactions may go unreported and unacknowledged. They also stated that low reporting rates endanger public health. Number 2, vaccine products are not evaluated against a neutral placebo. On examining the vaccine safety science, what an informed parent discovers is that none of the vaccines on New Brunswick childhood vaccination schedule were tested against a neutral, inert placebo. The reason this is so critically important is that without a comparison study, no valid claims can be made about the vaccine safety or efficacy, nor the safety of any combination of vaccines. This standard of safety testing is required for all pharmaceutical products excepting vaccines. This fact was recently confirmed by the Informed Consent Action Network, which analyzed all of the scientific evidence on which Health and Human Services rests its claim of vaccine safety. ICANN meticulously reviewed every single study, and there were over 1,000, provided by HHS, and which is the basis on which the FDA and, by extension, Health Canada licenses vaccines. The lack of a proper placebo-controlled comparator group for safety-based studies should concern everyone committed to health and safety of our children. 3, pre-licensure testing periods are too short to evaluate the long-term safety of vaccine products. Another concern is the unacceptably short time period for pre-licensing safety testing of vaccines. While pharmaceutical products are tested for safety for years prior to licensure, childhood vaccines undergo pre-licensing safety monitoring for a few days to a maximum of a few weeks. This brief pre-licensing monitoring is not long enough to reveal whether vaccines cause autoimmune, neurological, or developmental disorders like autism, learning disabilities, attention deficit hyperactivity disorder, life-threatening allergies, asthma, and other disorders. These disorders will only become apparent after the child is a few years of age. So let me give you an example of how the pre-licensure safety monitoring of vaccines compares with other pharmaceutical products. Let's consider Viagra. The pre-licensure safety testing for Viagra was conducted over a 10-year period with thousands of subjects. Both a subject group and a control group were utilized. The control group received an inert placebo, a sugar pill, that looked identical to the pill given to the subject group. After 10 years, researchers compared the health and efficacy to determine whether the product was both safe and effective. Now compare this with the pre-licensure monitoring of childhood vaccines. Safety testing is conducted on a small group, small sample, which may or may not include infants and children, is not compared against a control group receiving an inert placebo, and the period of testing ranges as short as 48 hours to as long as 6 weeks. Here is an example of the duration of safety review for the various vaccine products licensed in Canada. Hep B, produced by Merck, and I have to point out that New Brunswick is only one of 3 provinces or territories that injects newborns on the first day of life. It was actively monitored for 5 days and included 147 participants. The Hep B by GSK was monitored for 4 days. The DTaP was monitored for 8 days. The MMR was monitored for 42 days and included only 342 children. Polio was monitored for 3 days, Hib for 3 days, pneumococcus for 7 days, rotavirus for 8 days, meningiococcus for 7 days, influenza for 4 days. Health Canada claims, and I quote, that it conducts rigorous scientific review and testing of vaccines to assess their quality, safety, and efficacy before they are approved for use. Well, I contacted Dr. Theresa Tam, Canada's Chief Medical Officer, in 2018 to request evidence of the safety testing conducted by Health Canada. And to date, Health Canada has refused to provide any evidence to support their claim of rigorous scientific testing. And so I have empathy for the Chief Medical Officer yesterday who did not know the answer to this question, because I've been trying to get the answer and I hope she can get it. A copy of the letter that I sent to the Chief Medical Officer with these questions is included in your package. Number 4, the safety of the vaccine program has not been established. Our public health officials claim that the artificial stimulation of the immune system with injected ingredients, which we call vaccination, is the safest, most effective, and best way to protect our children and communities. This opinion is not, however, supported by robust scientific evidence. The fact is that we don't know the safety of the current vaccination program because the science has not been done to the level that would produce this conclusion. This is not my opinion. This is the finding of the prestigious Institute of Medicine, which found that the safety of the current childhood vaccine schedule has never been proven in large, long-term clinical trials. They state, and I quote, "Few studies have attempted more global assessment of entire sequence of immunizations or variations in the overall immunization schedule and categories of health outcomes, and none has compared entirely unimmunized populations with those fully immunized for health outcomes of concern to stakeholders." In 2011, the IOM reviewed 155 health conditions associated with the varicella, tetanus, hepatitis B, and MMR vaccines. In only 5 cases did the scientific evidence reject causation. In 134 cases, the IOM deemed that there were too few scientifically sound studies published in the medical literature to determine whether more than 100 serious brain and immune system problems are or are not caused by the vaccines. And these include multiple sclerosis, arthritis, lupus, stroke, SIDS, autism, and asthma. In 2012, the Cochrane collaboration reached this conclusion about the MMR vaccine safety testing. And I quote, "The design and the reporting of safety outcomes in MMR vaccine studies, both pre- and post-marketing, are largely inadequate." If you read the vaccine information inserts provided by the manufacturer, and you should, they clearly state that vaccines have not been tested for safety for their ability to cause cancer, their ability to damage an organism, their ability to damage the genetic information within a cell, their ability to change the genetic information of an organism, their ability to impair fertility, or for long-term adverse reactions. In 1987, Congress mandated that Health and Human Services continuously improve the safety of vaccine products and report on their progress every 2 years. In 2018, in response to a Freedom of Information request, HHS admitted that it had failed to file even a single report to Congress on improvements to vaccine safety over the 30-year period. Thank you. Number 5 is legal immunity puts us all at risk. So if vaccines harm children and adults, why aren't vaccine manufacturers being sued in a court of law? As we know, the U.S. is notorious and has an appetite for legal retribution. Well, the answer to this question is that in 1986, U.S. Congress passed the National Childhood Vaccine Injury Act. This legislation terminated the right of individuals injured by vaccines and parents of vaccine-injured children to hold vaccine makers accountable in a court of law. The consequence of this act is that vaccine makers have been given blanket immunity and are not legally or financially liable for any harm or deaths caused by their products. So think about this for a moment. Vaccines, they're the only product, medical or otherwise, where a manufacturer is not legally responsible for injury and death caused by their products. The result of this legal immunity is that no one is held accountable when injuries and deaths occur. Would we accept this lack of accountability with any other product? So why do we permit this lack of accountability with something as important as childhood vaccines? And finally, if vaccines are as safe as claimed, why do vaccine manufacturers need immunity? A consequence of this legal immunity is that there is no legal or financial incentive for the medical industry to make their products safer, even when there is clear evidence that vaccines can be made safer. What you discover when you carefully examine the vaccine safety literature is that the safety of the vaccine program has not been established using sound, rigorous, independent science. Dr. Lyons-Weiler clearly described the inadequacy of vaccine science in his presentation yesterday. So when public officials make the unqualified statement that vaccines are safe and effective, they are either misinformed or they're not being openly transparent about the status of vaccine safety science. Given that vaccines are a product given to healthy children, the level of safety testing ought to be even more rigorous than is required with pharmaceutical products. This is not the case. The safety testing of vaccine products is less rigorous, incomplete, and protocols appear to have been designed to obscure identifying long-term adverse effects of vaccines. I recognize that there is a strong belief in vaccines. I suggest that the vaccine decision is too important to be made based on belief. Etta West, the co-founder of Vaccine Choice Canada, made the following statement: "We know that parents who vaccinate their children sincerely believe they are protecting their child from harm. They believe vaccines will provide a type of health insurance, shielding their child from disease." At Vaccine Choice Canada, we think it is important that we push beyond using belief as the basis for vaccine decisions and instead decide from a place of information based on quality scientific evidence. I'd like to take a few minutes to explain the impact of Bill 39. Bill 39 effectively gives the state the power to decide what is injected into our body and our children. This legislation eliminates the medical ethic of informed consent. It removes therapeutic choice. It denies a parent's right to make medical decisions for their children. It disregards bodily sovereignty. It invites discrimination. And it undermines a child's right to a public education. Bill 39 also removes a critical mechanism of accountability, which is voluntary choice. I won't read the article out of the Declaration of Bioethics and Human Rights. It's already been mentioned by the previous speaker. The human right to self-autonomy and bodily integrity is arguably the most important right we have. I invite you to contemplate the implications when an individual or a parent is no longer able to dissent from submitting to an invasive medical procedure that carries the risk of permanent injury and death for themselves and their children. The measure of any health policy ought to be, does this policy increase the overall health of those receiving the product or intervention? For decades, vaccine safety science advocates have been calling for studies comparing vaccinated versus unvaccinated populations for overall health outcomes. Public health institutions, including Health Canada, have refused to do these studies. It should concern us all when the medical industry is unwilling to do basic science needed to confirm whether vaccinated children are healthier than unvaccinated children. We ought to be measuring health, not vaccine compliance. We are witnessing a breakdown of trust between civil society, government, and the business of medicine as a result of this intense lobbying to turn our children into a captive market for the pharmaceutical industry. Parents of vaccine-injured children are no longer accepting claims of vaccine safety on faith. Their trust has been broken. Unless trust is restored, health and justice will be nearly impossible to achieve. The question for this panel and this government is then, will trust be restored by the imposition of vaccine mandates, or will vaccine mandates further erode the precious contract between citizens and government? I respectfully suggest that there is a legitimate concern amongst citizens of whether financial conflicts and institutional self-interest are transforming our public health agencies into appendages of the very pharmaceutical companies that they are meant to regulate. Children's Health Defense Chief Executive Officer Robert Kennedy Jr. stated, "People will vaccinate when they have confidence in regulators and industry. When public confidence fails, coercion and censorship become the final options. Silencing critics and deploying police powers to force untested medicines upon an unwilling public is not an optimal strategy in a democracy." So what is a caring and considerate government to do? I suggest that governments ought to do what you are presently engaged in, creating a space in the public square where conversations about the safety, effectiveness, and necessity of vaccinations can happen. This is a complex matter that requires all of the consideration, respect, responsibility, and humility that we can give to get this decision right. I reached out to the Canadian Broadcast Corporation to create a safe space where ideas could be shared, information exchanged, fences dismantled, and relationships mended. I hold the perspective that how we make the decision is just as important, if not more important, than what we decide. A copy of this letter is in your package. In the letter I wrote, I'd like us to have a rich conversation that honors each other's perspective and experiences. I want us to make wise decisions, not reactive decisions. I think we want the same thing. Will you join me in this conversation? Will you help me to build a container where true dialogue can happen, one that holds everyone's voice? I make the same offer to the legislators of New Brunswick. I respectfully suggest that this is where this government focuses its energies rather than rushing into a decision. Vaccine Choice Canada created a document to help address the growing hesitancy in vaccination and the loss of parental trust in public health. A copy is included in your package. Some of the suggestions include open and honest dialogue, supporting informed consent, independent oversight of the vaccine industry, long-term safety testing, developing effective safeguards, and vaccine injury compensation. Whether we realize it or not, this is an historic moment in New Brunswick. This is a moment when your legislative representatives have an opportunity to clearly support our inalienable right to freedom of conscience and religion granted to us by the Charter of Rights and Freedoms. It is also an opportunity to unambiguously affirm our autonomy and sovereignty as free citizens whose right to informed consent is safeguarded for this and all future generations. The families of Vaccine Choice Canada respectfully request that this committee embrace the medical and legal right to fully informed consent, recognize the right of parents to medical decision-making, and honor the principles and values of a free and democratic society. Thank you for your concern and your compassion. The time you are taking for public input is critical, for wisdom cannot be developed in a vacuum.
Time for one question. Again, I will ask the audience to refrain from clapping, or I will clear the room. You have time for one question.
Madam Chair, Mr. Kuntz, bienvenue à l'Assemblée législative. Thank you for being here this morning. So I've got one question. I've divided it in two parts. So you mentioned that the mission of Vaccine Choice Canada was to inform parents and individuals on vaccines. But do you rely and share research done by recognized medical bodies, medical associations, and the Centre for Disease Control in order to inform your members? So that would be the first part of the question. And the second part would be, if ever the Legislative Assembly were to vote in favor of Bill 39, would Vaccine Choice Canada appeal the decision through the courts, and how far are they willing to go?
So the answer to both questions is yes. And how far would we go? We would go to the Supreme Court of Canada.
Thank you very much.
Thank you very much for your presentation.